Can you talk about whether it is allowed for people that are BRCA, that have had breast cancer, that are high risk, or if there's a space for it, or is it one of the many things that are?
There is a space for it, especially when you've been cancer-free for a long time. However, I would really like to get a clearance from your oncologist, because obviously no doctor wants to take that liability. So generally, I actually have a very good relationship with a breast surgeon in near me, and she has a breast center, and generally she gives me the okay by looking at the patient's history and looking at the type of cancer that the patient has had. But yeah, even estrogen and progesterone still has space, depending on what type of cancer it has been.
Yeah, so I use vaginal estrogen is all that I've been approved for now, and then recently some kind of skin cream estrogen that I got, but like adding I'm on an aromatase inhibitor, so I don't know, it is obviously an oncology question, I just was wondering if there is even.
Right. So if you're experiencing a lot of hot flashes, you can actually use a supplement called Estrovera, which is by Metagenics, and it's the root of rhubarb. So it's completely natural, and it actually regulates the thermometer in the brain. And I've had great success with Estrovera, 1 to 2 capsules in the morning. It can cause a little bit of GI irritation or heartburn, so be careful with that. Just take it in the morning, don't take it in the evening. And then in my patients, it's cut down on hot flashes by 80 to 90%. So again, my worry is not so much the hot flashes. The hot flashes can be managed by cutting out alcohol and coffee and wheat, gluten, soy, corn, allergenic foods, and eating a lot of cruciferous vegetables. The concern I really have about menopause is the bone density loss, tooth decay, brain function, muscle mass that's being lost, sex drive, all those other, Alzheimer, because we need these hormones for proper functioning. So I highly encourage you to speak to your oncologist and really delve a little bit deeper, because I don't know what type of, whether it was estrogen positive or, and figure out if you would be a candidate for hormone therapy. And I also, maybe some of the OBGYNs in the room would disagree with me. I don't agree that if you haven't had hormone therapy up until age 60, that you're absolutely not a candidate to get hormone therapy after age 60. Because if the hormones are given in the right format, meaning estrogen is not given in a pill form, you do not want to take estradiol in a pill form, because it can cause coronary artery disease. That's what those studies were really indicating. So after age 60, if you have not been on hormones for, let's say, over 10 years, you still should be considered for hormone therapy, because you have another 30 to 40 years to live. You don't want your body to function without hormones. And I have 80, 90-year-olds in my practice who are taking hormones,
for the same reason, exactly.
and they're functioning like
Optimally,
they're
yeah.
30 years younger than themselves, right?
I'm going to ask the last question. So for the women who are on the pill, okay, and this could be for anyone, maybe Dr. Shiva or Angela, women who are on the pill, who are either perimenopausal or even going through just, want to prevent getting pregnant. What would you say to women who are on the pill, and how that affects us in the long run?
So this is a very loaded question, because
Condensed version, please.
the pill is synthetic estrogen and synthetic progestin. And there are other ways that pregnancy can be prevented. There's now Mirena IUD, there's copper IUD, there is withdrawal, there is condoms, there is, diaphragms. So little by little, I think I transition my patients off of their birth control pills and start them on bioidentical hormone therapy.
And is that a way for prevention?
No.
Exactly.
Bioidentical hormones do not prevent pregnancy.
Exactly. So they have,
Like I said,
there's
there's
other
other,
options.
yeah.
Okay.
I would